Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good morning. Once again, welcome back to MAHSA International Dental Conference 2022. Here we come to our second keynote lecture. Before we talk about the lecture, let's introduce our respected speaker. Professor Dr. Noor Hayaty Abu Kasim is currently a visiting professor at the Faculty of Dentistry, MAHSA University. Her 35 years of clinical practice has been interspersed by research, teaching, and management roles. Recently, she completed her term as the Dean, Faculty of Dentistry, University Kebangsaan, Malaysia, UKM. She was the Dean of Wellness Research Cluster at University Malaya, where she facilitates an interdisciplinary network of researchers involved in a broad range of research area and innovation. She's also contributed towards promoting dental research through IADR, Regional Development Program in countries such as Indonesia, Philippines, Vietnam, Myanmar, and Cambodia. Her research interests include biomaterials, prosthodontics, regenerative medicine, and dental education. As a dedicated teacher, she involves herself in dental education research, where soft skills, reflective teaching and learning, and clinical competencies are amongst her area of interest. She often takes time to reflect and engage in endless discussions to make teaching and learning interesting and fruitful for her students. Personally, I'm honored that Prof. Dr. Noor Abu Qasim was my supervisor during my PhD. So let's all welcome Prof. Dr. Noor Hayati to present today topic revisiting preclinical and clinical dentistry. Welcome, Prof.
Thank you, Afaf. It's always a pleasure to be back, and it's always a pleasure to have the introductory remarks by former students. And I am very proud of your achievement, and you have, shall I say, one of the students who has um, made my supervisory experience a pleasure.
Thank you.
Thank you, Ahok.
It's an honor.
Okay, so I shall share my slide now. So basically, I just want to let everyone know. So very good morning and Assalamualaikum warahmatullahi wabarakatuh. So although the title is Revisiting Preclinical and Clinical Teaching in Dentistry, I will not be dwelling much into the actual clinical training and clinical training, but trying to share with everyone on other issues that has come about in the students, hence the need to revisit this topic. So thank you again to the organizing committee of Mi-Dent 2022 from Faculty of Dentistry MAHSA. Special thanks to Prof. Rosna, the Dean, who's also a friend and confidant. So my journey as a teacher, as Afaf said just now, has been 35 years as an academic. I consider myself a very passionate teacher, and mentoring is one area that I love, and doing research is something that I will not stop and continue to do. Although I have completed my term as dean at UKM, I still miss research, and it's like having a headache not doing research. Um, just want to share with you again. I have shared this slide a few times actually in various other lectures. It's just reminding us on our academic life and what does a lecturer do. I think if we show this to a young lecturer, they may not want to join the dental school. However, we have to be very practical about and come into academic life with our eyes open and knowing what is there in store for us. And out of the three areas here, although I embark on research on stem cell and biomaterials, teaching has always been my passion. And while I wanted to be on a teaching track at University Malaya, when there was tracks there, I was not allowed to do that because of my research profile. But nonetheless, I take a lot of, I also do research in teaching, and this is more to enhance and to really get feedback from students so that we can continue to change the way we teach. So my teaching philosophy has always been I am a facilitator of learning. I would like to think of myself as a facilitator for learning. Also as a facilitator when I was the dean at research cluster, looking into multidisciplinary research, and also a facilitator to the staff at Faculty of Dentistry UKM when I was there. I would like to establish that I do engage in reflective practices. However, not being trained in pedagogy, sometimes the way I do reflection is kind of very basic, sort of more at a personal level. Um, but to let you know that even after this lecture, I will be reflecting on how I did and whether I have engaged with the participants, and even at every lecture when I do for the undergraduate student or postgraduate, I reflect on how I did by looking at their body language and how they respond to me. And I've always wanted feedback as a tool for growth in terms for my development as a teacher, because I always wanted to be a teacher, and but my father told me that I have to be a dentist, not just a teacher. But the good thing about listening to your parents is they really feel for you. So in the end, I am still a teacher, although I'm a dentist. So let's go back to dental education. I think dental education can be considered complex and challenging because the things that we have to do, not only we have to make sure that the students have knowledge, strong in the theory, but they also have to have acquisition of psychomotor skills as an important step towards a successful career. Not just a successful career, but also to be, uh, shall I say, responsible dental health care delivery personnel. So when we talk about dental education, we then go back to preclinical training, where study and mastery of theory and techniques related to various dental procedures are required prior to treating patients. I'm sorry, here I put human patients, but prior to treating patients. We traditionally we have simulation, and we will go through some of the advancement, but I will not go through very detailed in terms of preclinical training. And then because of once they have done their preclinical training, we have faculties, we are lecturers, are expected to ensure that the students develop an appropriate level of understanding and dexterity when treating patients in the clinic. So not only complex and challenging, but it could be, shall I say, we are responsible to make sure that they can treat the patient, because some of the procedures are irreversible, and we have to take um, accountability in what they do. So I think to say it is dental education is challenging is probably rather mild. So how when we advance dental education, I think there are three factors that interplay in dental education. Students, nowadays we felt that I don't know about others, but do you also feel that today's students is different from past students? Is the the way the students learning, is it the same as how we learned many years ago? The other thing is, we as educators, how do we remain relevant? Are we continuing to challenge ourselves to change and to keep up with the students' expectation and learning environment? Is I think your is it your deputy vice chancellor, I think, or at the opening, telling us that there are many advances and technology advances in dentistry, but are we providing that state of art instrumentations to the students, and maybe they are expecting such state of the art instruments. So just revisit, yeah, the dental simulation for clinical preclinical training. I'm just focusing more on operative because this is the bread and butter of dentistry, and it is also my area of specialty. So we see that many schools still use simulator uh, such as this, and I'm happy to say that many schools also has tried to incorporate technology into their simulator, so that the students can uh, feel and understand and learn better. Yeah. However, this is not an easy task, shall I say, because it gonna cost schools quite the investment is quite big when we want to look into the technological advances in dental simulation. So for example, King's College, yeah, recently, I think last year, has changed their traditional way of teaching. Actually, they have this traditional way of teaching, but they have some hectic uh, units for the students to try and to use for their own assessment. So is University of Hong Kong, and I'm sure other universities also have this. Yeah? However, recently they have moved to probably totally hectic simulation, where I saw in the news that they have renovated their entire simulation clinic. Well, for Kings, I think they are involved in the development also of these units, and they have been, shall I say, working and exposing their students to this technology. The question arises is this good enough to prepare our students to treat the patients in the clinic? Is virtual reality or even augmented reality uh, can prepare our students for to treat the patient in the clinic in the way as a responsible clinician. At the same time, we should also ask ourselves in terms of we as teachers, do we are we able to train the student and create understanding and feeling how when they actually treat patient, yeah. So there is an article October of 2020. I think our keynote speaker just now, Professor Chu, this is his paper. He is the corresponding author, because I said earlier that Hong Kong has been using haptic for a long time, and haptic has been there for a long time, and also simulators such as Densim and so forth. Yeah, Singapore also been using, but they have been using this Simodon. I think it's by Nissin. In this paper, they look at the other findings. It is more of a review paper. They look at other findings such as Debo, Zafir, Mube, Yuan, and they found that uh, Simodon, this is especially in reference to Simodon, enhance student performance and appreciate student working in virtual learning environment. It has assisted preclinical training in both restorative procedures, in PITS, and also operative, and also in endodontics, I think. And in their paper, they concluded that Simodon provide a platform for students to hone their manual dexterity skills and practice repeatedly prior to conventional preclinical simulation. I think from here we know that they don't only use virtual technology, but they still go back to conventional preclinical simulation, because nothing beats the actual cutting of a tooth. I mean, especially an extracted tooth. Yeah. So I'm not sure whether they use typodon or extracted teeth, but I know in UKM and at University Malaya, we use both. Yeah. The cost of the internet initial setup and maintenance can be very high. So I think in Hong Kong they don't have. They have a few units. A few means not just one or two, but enough for the students. Yeah? But Simodon give force feedback mechanism that provide trainee with tactile experience of drilling various tissues. And it also empowers students via self-learning and assessment with guidance provided for diagnosis and treatment. So I think from this paper is clear that we can establish that while it gives the student the opportunity to practice on their manual dexterity, meaning that did they cut the tooth too much? Did they go beyond the depth the depth that is indicated, and they can do again and again. However, they still do conventional preclinical simulation. So, how do we transition from preclinical to clinical? Yeah. So there's another article also in 2021, a bit earlier than Prof. Su's article. They look into preclinical to clinical transition experiences of dental students at an Australian regional university. Yeah? They did both qualitative and quantitative data, and they tried to triangulate their findings. And what they found is students are more engaged with learning during clinical training. they are characterized by self-regulation and personal reflection. I just want you to remember this word, self-regulation and personal reflection. Personal exploration of level of knowledge and understanding. The student go into reflecting of their level of knowledge and understanding, going through their learning more so in the clinic than in preclinical. And therefore, they suggested that early development of self-regulated learning skills may prove useful for smooth transitioning. We'll go back to this slide because I had a bit of, shall I say, problem, just battling with myself in my mind, how I can make this lecture transition smoothly. So you will see this slide again once we go back to some issues. So let's go to the students. Yeah. So as I said, I'm not going to dwell into what are the preclinical training. Maybe we can discuss that later. But we have other challenges also. Yeah. But students, I think often we've heard that, as I said earlier, today's students are not the same as whom we have taught before, especially for someone like me who has been academics for 35 years. So who's who over the years? Okay, I am in the baby boomer category. I'm not sure how many more, maybe Prof. Rosna also in the baby boomer. We are face to face or call. I like to call and make a conversation. Baby boomers tend to live to work, so that's why when Prof. Rosna said, "Could you accept our invitation to do this?" I immediately say yes because I live to work. Touch tone phones. Respect my title, me generation. Relationship focus at work. Work comes first. Career, title, maybe we can go low on the money. Then comes Generation X, born between 1964 and 1980. Also phone, email, and messenger. They work to live compared to live to work. Give them the latest technology. Respect my ideas, independent. Very output focused, and family comes first. Then millennial or the Gen Y. Yeah? I have some difficulty sometimes with my research assistant. When I call, she don't answer. But when I text, she answers. Yeah, because it's just text me, play, then work. I'll Google it myself. I like to remain connected. Of course, if you tell them, they appreciate it, but they still just sometimes challenge you. Challenging is not a problem when we are teaching. Respect and challenge them. Helicopter parents, yeah, and prefer teams. When I say here helicopter parents is because baby boomers now are really focusing on work, and many parents are working parents, so we tend to look at a general overview and not very hands-on like our parents earlier for baby boomers. For example, my mom didn't work, so she could focus on me. So it's more of helicopter parents, and they prefer teams, focus on involvement in digital natives, Wi-Fi, and just like my son, friends comes first. And now Gen Y, and I think in the dental school now, we are having millennial and Gen Y. Maybe Gen Z or iGen is coming into first year or just into foundation studies now, I think. Yeah. So they are all about me, Instagram, Snapchat, Twitter, everything that they eat, they put on Instagram. They share things, and sometimes I wonder, what don't they share? But work, when it comes to work, what's work? Apps versus internet, they prefer apps. Creative, also helicopter parents. Digital natives, touch screen. In terms of who comes first, whether work, friends, I think in the literature, from this presentation, it says that still coming of age. And this slide is totally lifted from Donald Kasim lecture on millennials and beyond. So, millennial generation, who are they? They are very diverse. They are very service orientated, pressured to perform, related to they being very protected because their parents are very involved. When their parents are very involved, they tend to be pressured to perform by their parents. They are well connected. There's no boundaries. They are very ambitious, in a way structured, that could be maybe not everyone, depending on the upbringing and also culture. And so is excellent time managers. In general, they probably be excellent time managers. But as literature show that the generation, the habits and the trends are very, very influenced by their growing up environment and their culture and so forth. So this is a very general characteristics of millennial generation. So we may be seeing most of them, for example, diverse, service oriented, very protected, connected, yeah? And also ambitious, but may want to do it in a very simple way. So Christy Price in 2009 mentioned that there's a gap between expectations and performance among the millennials. Yeah, they like that she put them into, if you want to engage millennials in learning, she suggested that we go to this 5R. Yeah, so research based methods, it's not that they are interested in research, but we should, teachers should use research based methods, meaning collaboration, working groups versus lectures, varied learning styles. I am sure we now notice that more and more students tend to like to miss the lectures because they think they can learn through other channels. Yeah, they base on rationale, or authoritarian teaching is not effective. Instructions explained are followed. So they want you to tell them what to do and how to do it. Yeah. So they are not really interested in learning and go learning by themselves. In a way, they do. So there is a bit of pros and cons in there. What I mean is contradictory views in terms of that, whether they learn by themselves or not. They may not be learning the right thing. That's why I think Choose a program is very focused on a closed platform, so that they learn the right thing. Yeah? So they prefer to be relaxed. They prefer laid back sessions, warm, empathetic environment. They want to remain relevant. They grow up with Google, as we said also just now with Siri. Information that is timely and relevant, not just information. And they like rapport because they receive more attentions as kids, and they bond quite quickly with instructors. Yeah? So these are the suggested um, mode of areas of focus that's been suggested by Christy Price if we want to engage millennial in learning. So as I told you, we get back to this transitioning from preclinical to clinical training. So in here it was suggested that uh, try to early development of self-regulated learning skills. Yeah, so it was suggested in this paper that self-regulated learning skills can be useful. Not just self-regulated learning skills happen when they are in the clinic, but if possible, to start it early at preclinical, or even, of course, better at foundation and at schools. Yeah, but we cannot control what the student learn at schools or at foundation. So the only place that we can start developing self-regulated learning is during their preclinical years. So how do we institute self-regulated learning and be a champion in here? Yeah? So self-regulation is not a mental ability. It is not even an academic skill. It is a self-directed process that learners can use to transform their intrinsic mental abilities into academic skills. And self-regulated learning is a cyclic process wherein the student plans for tasks, monitor their performance, and then reflects on the outcome. So I capitalize the word reflects here because reflection is important in self-regulated learning. And reflective learning so because of that we go to reflective learning, because allow learners to step back from their learning experience. I think in preclinical, my experience at two universities, at two universities, they are still doing conventional teaching, where you are supposed to do this number of amalgam restoration or this number of composite restoration, and they just go on and do that number, and we assume that by doing 5, 10, or 6, that they know and they understand what they are doing and they are equipped to treat the patient in the clinic. However, I think most of us notice that when they come to the clinic, it is a different scenario. Yeah, so we don't advocate reflective learning even at preclinical. So this is what I'm trying to propose through this lecture, to allow learners to step back from their learning experience. But I tried to I tried to talk to my colleagues about this. However, the barrier was we don't have time. The students still have to do this number of restorations and so forth. Yeah. So we really have to change our mindset. So reflective learning helps the student to develop critical thinking skills, improve on future performance, and analyze what they have learned and how far they have come. So I actually we tried to do this in one of the session a few years ago, but somehow, because I was also the head of the department at that time, it was rather difficult to ensure that it was working well. Yeah. So advantages of, just let's go through advantages of reflective learning. Yeah? Oh, by the way, I like to acknowledge Presentation Go. All these templates from Presentation Go. It is a free template, and I love using them because they make me feel good about my presentation. So advantages are accepting responsibility for your learning, and as a result for your personal growth when you reflect. Becoming metacognitive, becoming metacognitive or aware of your internal thinking process. So you may want to know what is metacognitive. It's a process of thinking about thinking. It refers to you thinking about your knowledge, whether you have enough knowledge in what you are doing, and whether how you can improve yourself. Yeah. So cognitive is the knowledge, and becoming metacognitive is ability to analyze and process what you have learned. Yeah, and becoming aware of your motives with your action. So here is more like if you are doing uh, I try to be up to date with ICDAS and not say class 2, yeah. Uh, Proximal, occlusal proximal cavity at operative technique or preclinical session where you do an amalgam, where you are doing a restoration for amalgam. So when you say that you're becoming aware of your motives and your action, is you know that when you're preparing the cavity, you think of the property of the material, what are the characteristic of the cavity, what features need to be incorporated. So when you do reflective learning and you empower the students to reflect, they will become aware of their what they do and their actions, yeah? And they will see a link excuse me, they will see a link between the work that they put in and the learning and the outcome observed. So this is the advantage. However, reflective learning takes time and practice. Not only practice by the students, but also by the teachers. If the students, if we empower students to uh, embrace reflective learning, we also, as teachers and educators, then have to practice reflective. Yeah. So just a little bit on the theory. I'm not very good at this. I take this opportunity to learn about reflective learning also by this lecture. So this is also the reason why I took up the challenge from my good friend Prof Rosna. And also every time I take up the challenge to review a paper when I don't really I'm not really so good at it. As for example, when I first started working on stem cell, so I didn't know much about the stem cell biology, but taking up the challenge of reviewing paper because of the paper published has made me better and know more. Yeah. So it's reflective learning is not new. It is known pedagogy, and it is being used mainly in education, and also we have also used reflection. Yeah, I'm sure many of us reflect on how we do our classes, how we do our work. That's why we have reviews, and we continue to modify our learning and teaching materials and so forth. So John Dewey was the first one to describe reflection was a necessary precursor to action. In other words, he advocated that students need to think and mull over what they have read and encountered, and after doing this, they can apply the knowledge better. But maybe as a educator in dentistry, we base our teaching on experiential, and we are not trained in this area. Yeah. And then in 1983, Donald Shawn, I think, talked about reflection on action, which is an unconscious event that deals with knowledge we use to solve problem and carry out action, or reflection in action that occurs when happening. So the difference between this is reflection. I'm looking at my laptop now because this is very new to me, so I have to refer to this so that I don't tell you the wrong thing. Yeah. So reflection on action is thinking about something that has happened, compared to reflection in action is while you are experiencing it happening. Yeah. And then thinking about what you would do differently the next time when you reflect on action. But inaction mean thinking about what you are going to do next. Yeah. So for example, if I experimented on this many years ago, as I told you, when I was head of department of conservative dentistry. I convinced my younger staff to take photos, to take images, not photos, images, because it can be rotated and so forth. To take images of cavity preparation done by students and put them into groups so that they can talk about how they have prepared their cavity, whether it's right and what is wrong, and talk to each other. However, at that time, we did not have the right tool or the financial assistance to buy the right equipment so that we can take photos or images of these cavities. But now, if you are using haptic, if your school have all these are images that can be stored, and this is how you can combine technology and teaching and learning strategies. Yeah. So we tried that, and actually the students quite enjoy it. But because of the limitation of the equipment, in the end, it was taking too long, and it was a burden to the lecturers. So then we kind of abandon it, but we continue with some reflection, learning, teaching and learning. However, it wasn't so successful, I think, because it's more of writing things down, and the students don't really like to do this, especially Malaysian students. So, so the other thing is, when you do reflection on action, is taking your time, thinking about what have you done. But when you do reflection in action, is acting straight away. So reflection in action, like I told you just now, when the student are going to prepare a cavity to receive amalgam, so they continue to reflect in action, where, okay, this is my knowledge on this material. This is what I know about this material. So they will be doing work in a very systematic manner, and they really understand what they are doing. And David Koch in 1984 developed an entire learning cycle to include element of feeling, watching, thinking, and doing. So I share with you the cycle. This is his cycle: concrete experience, reflective observation. Let me share with you what it means, because this is also new to me, and I'm also trying to internalize. If possible, we can internalize this together after this lecture. So the expansion learning cycle is a four-stage process that describes a four-stage process of how we acquire and embed new knowledge. The theory embraces the idea that we change as a result of experience, reflection, conceptualization, and experimentation. So in detail, for each compartment is, when you say a concrete experience, the learner encounter a concrete experience. That means it might be a new experience or situation. Okay, they've done a cavity for an amalgam or a composite. So there is a concrete experience. They have the actual experience. So when we do our preclinical, maybe we shouldn't let them straight away do reflection, but present something interesting on how they can have a concrete experience. I have some ideas. We can talk about this later. So number two is reflective observation of the new experience. Yeah. So in our traditional way is, we tell the student, okay, we have a demo, how to cut amalgam cavity. I like to talk about amalgam cavity or inlay, ceramic inlay. Okay, since we are in the face down, yeah, we are not face out but face down in that era now. So maybe we talk about inlay. Yeah. So when we talk about ceramic inlay, we give the student sound tooth. Yeah, in preclinical, I'm talking about preclinical. We present the student with a sound tooth. and then we give them the principles and the characteristic of the cavity, and we expect them to produce this cavity after the demo. Some students cannot internalize this. Some of them, what I noticed is they felt that, why am I cutting a sound tooth? So, and I found out, although I was at UKM for 2 years, I seldom go into the learning environment, yeah, because of the meetings and so forth. So I found out that recently in UKM they actually use carious teeth. So I thought, oh, that's good, but I yet to see how it's done. Yeah, so they can reflect on that new experience. Abstract conceptualization, reflection give rise to new idea, and then active instrument experimentation. So after the reflection and doing that, then they can actively doing that preparation. Yeah. So I'm thinking of maybe later we can together discuss this cycle and how we can put this into perspective for preclinical or even clinical dentistry. So Gibbs later, I think a few years later, make this cycle a bit easier for us to understand. So description what happened, what are you thinking and feeling when you are doing that, when you are preparing that cavity. Evaluation what was good and bad about the experience. Analyze what sense can you make from the experience and what need to be improved on, and what are the action plan, how you will improve for this. So I think this is a good model for discussion for us later, and I look forward to that. So just I told you an example. These are from published article, and it's we can download it. So it's with permission. So for example, of course in haptic or decimodon or densim, when you cut the cavity, it gives you a feedback of, oh, you've gone too deep. For example, here you're supposed to be 1.5 to 2 millimeter. You are now in 3 millimeter, or you're more than the wanted intercuspal width, and so forth. Yeah? What we were trying to do the last time was actually taking images of the preparation and let the student discuss. So, but this is from an article on fracture resistant, but I was just taking the images to show you how we did at one time. Yeah. So, if we are thinking of the students, what are the learning style of the students? Have the student changed? We also need to make sure that we as educators remain relevant. Reflective educators embrace learning through and from experience also towards gaining new insight of self and practice. Look at what we do, think of why we do it, and if it works, if our what we want to impart to the student is being imparted in a very effective way. So it is a process of self-observation and self-evaluation. So reflective practice in practice, yeah, practice in practice. So we should, as teachers and educator, we should be self-questioning, experimenting on new ideas, discussing with colleagues. So I love discussing with my colleagues, and I sometimes throw in ideas and talk about totally things that may sound silly and things like that. And what are the problems? Discussing with the students when you are supervising, you talk to the students and say, is this right? Not just looking at the preparation and say, okay, this is done. So we some school have self-assessment, discussing with the students the self-assessment criteria, and then observations and feedback. So these are the important reflective elements. Just now I talked about sometimes students and learners. I think sometimes if you look at the meaning of student, some people say student just come class, whereas learners try to do things to improve themselves, to make sure that they learn. So when we, as I told you, we tried to do conduct reflective learning. So this was what we do. We revisit the tooth preparation. My idea was, if the student have reflected and understand what they have done, we do not have to ask them to do five more preparation. Then, meaning that if they really understand and know their mistake, they should be able to do one or two more only. So that reduces the time and really focuses on the understanding and preparing them to clinical and transitioning from preclinical to clinical in a very smooth manner. As educators, we have to look at innovative clinical project embedding clinical scenario. What I mean here is, at one time I thought that at the start, I would be very interested to know what you think about this. At the start of the preclinical session in operative technique, yeah, I'm not sure if many of you are in operative technique, in operative discipline, but I think even if you're a pediatric specialist or other, there's always preclinical sessions, right? So how do we so instead of telling the students, telling the learners, yeah, or the students that now this is the demonstration to cut composite restoration, cut cavity for composite restoration. Why don't we give the students a scenario and let them have a carious tooth, and just don't don't tell them what cavity that they have to prepare, and don't even have to tell them what the material. Why don't we just say, okay, this is a tooth that has caries. We present two different scenario. One is the property of the material is non-adhesive, blah 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 blah. For example, for amalgam, and the other one is adhesive and so forth. And just let the student on a journey of how they want to prepare that cavity based on what they think they should be doing. So it could be interesting to do this. And in the clinic, reflective learning can be used in treatment plan. So for example, I think we at the department, conservative or now restorative, we do make, especially the master's students, to write the treatment plan in terms of what are the things that they're going to do in stages. You mean that, for example, if they're doing occlusal rehabilitation, what do they have to do? The first thing that they have to do the occlusal analysis, they have to take the retruded contact position and things like that, and write reflection on whether the procedures that they have planned really take place, and if it does not take place, why, and how can they do better so that they can achieve what they plan to do. So by doing this, it makes their learning more effective, and of course using individual discussions and also through case presentations. So let's just now I said that we are now dealing with the millennial, but soon we will be faced with the generation Z or Z or I Gen, yeah, the future challenge, born 2000 onwards. So today they may be in foundation or almost maybe year one in dentistry. They are post this is September 11, early loss of innocence, most technique savvy, prefers incognito and anonymous social network. 8-second attention span. You go make them go on a semester break, and they come back not knowing what they have to do. But I think that happens now too. They are very phone separation anxiety. They have phone separation anxiety, politically liberal, and social equality is the biggest concern. Yeah. So how do we advance preclinical and clinical training into the future? Because learners change, technology advance, yeah, and population and expectation change. Even the patients have different expectations now. So does the generational learning differences exist in today's dental students? I think yes and no, depending on where they are, because I think the habits and trends is also very dictated by the culture and where they are. But but in general, today's students grow up surrounded by new technologies. Information know no boundaries. They know what the students in Hong Kong does. They know how the teaching in Harvard, probably because of the YouTube. And just now Afaf said they share in Facebook and things like that. Learning styles and trend vary from generation to generation. Adapting teaching approaches in alignment with technological advances that we have to do. However, in GIS, I think we should strive to be inclusive, providing evidence-based instruction to the next generation of dental healthcare providers. I just want to share with you my second last slide. This is a stone sculpture by Japanese artist Jiyu Seki, shared by my husband. My husband, uh, he's a very unconventional person. He shared with me, and I said, "Well, what is this? These are just stones," and he deleted some of it. Yeah. So he said that it does not matter what shape you are, but the moment you put the teeth, you will only see the smile. So with that, thank you. And I like to end with quote saying that learning is a process whereby knowledge is created through the transformation of experience. Thank you, ladies and gentlemen.
Thank you so much, Prof. That's very inspiring. Actually, I have to look back at our teaching method and adopt some of this concept you introduced for us. Actually, for last 2 days, I was in training about multiply intelligence. How everyone intelligence in a different way. I think, can we apply this for smooth transition from preclinical to clinical?
Of course, I think this is an area that we have to explore. What I mean is these are two different areas. The technology advancement is a different, but when we teach the students, we have to know and apply methods of teaching to make sure that they understand and they can apply all this knowledge. Yeah, just like here, I think on the private chat is
Yeah,
artificial intelligence is very
I'll
much
ask that.
discussed today. Yeah, because I can see the private chat.
Yeah,
Uh,
I can ask that.
yeah. So of course, the students still even native digital people need guidance in the learning, right? In the learning, but we have to keep abreast with this. And for a generation like me, wow, it's not so easy. Sometimes I get my son or my daughter, can you help me to do this and see
Same here.
how I can get this done. And even this lecture, I asked my son, do you think this would be of interest if you, as a young person listening to this, I reserve his comments, but I do tend to look into all this. So yes, artificial intelligence, yeah, is very very important, and artificial intelligence, I hope, will also one day, I'm sure some people are already doing this, that we can predict how we treat a young person. For example, I think 50 and 60 are still considered young in the area. But how do we treatment plan someone so that they are prepared for their old age when they are no longer independent to look after their oral cavity? So do we, some dentists I see on my trips overseas, they practically extract all the teeth and put all single implants from 7 to 7 on the up maxillary and also lower. So, or some dentists who just look into, okay, maybe one implant and things like that. But still, is it the right thing to do? And I think artificial intelligence can assist us with the data that we have. This is just an idea I have in terms of, because I am very concerned about care of the oral cavity when patient go into semi-dependent and dependent. I don't know whether I'm in the right track or not, or have just digressed somewhere. But
Yeah, absolutely agree. There will be a different when it's totally digital or human aid is still there. I
but we
agree.
should use all this technology, Afaf,
We should
to
use it.
assist us in providing better treatment and training better future dentists.
Okay, bro. The second question, would it be possible for the teacher, lecturer to assess how well students are reflecting and provide feedback that depends on the student's skills?
Yeah. Okay. The reason why reflective learning is not it takes time, because we are not I don't know about others, but I was never trained to write down what happened, what is it that occur, and why it did not happen as it should be. Yeah. So in one way, to know whether the student is to get the feedback is through writing a reflection note. Yeah. So they don't have to write very long. They just have to write one paragraph, for example. Or the other one is through group discussion. So from group discussion, like what I wanted to do for a few years ago, where we have smaller groups and the student talk about, oh, I did this. However, I think through the image I see that my wall divergent. It should be converging and things like that. So it is possible to know how well the student moving along, and from that feedback we can. But it is quite labor intensive. But I hope by doing that, we can lessen the number of project that they can do. So it may be a good experiment. Maybe MAHSA can take this up and do a small research on two groups of students, one just doing normal and the other one reflect and just have an experience and then reflect on it and do the restoration. If majority of the students can get it right, I am sure that reflective learning has taken place.
Thank you, bro, for the idea, for the research idea. We should apply that and promise us to be a co-researcher with us. I think that's all because we still have
Yeah.
active session. So
Further
we,
discussion, right, with the
yeah,
participants. Yeah.
I think
So
we've done
do
the.
I join Zoom now?
Let me thank you, Prof, and conclude this keynote lecture. Thank you so much, Prof. Noor Abu Kasim. It was very informative. And please, audience, stay tuned and join the Zoom for the interaction session on dental education. By this, I would invite Prof. Rosna to hand token of appreciation to Prof. Noor Abu Kasim.
Hi,
Hi.
thank you very much for the lecture, which give us a lot more insight into how we're going forward with educating the Gen Z, is it? Yeah. And also please accept our thank you and certificate of appreciation and a little gift which will be delivered to you at another time. Thank you.
You're welcome.
Yeah.
So
Thank
I will
you.
end this session. We don't have to introduce. We'll hand over to Dr. Granty to handle the moderate session on Zoom.
Okay.
So we'll go
Let's
up.
get on and be the
I think
zombies
this
now.
one already noted.
Yeah, we'll go out and join Zoom. Okay then. Thank you.
Thank you so much.